The Gambia Red Cross Society forms part of the technical response team with internationally credible to bail the country out in the fight against COVID-19. The society is known for building food security through community strengthening as far as women guarding to disaster risk reduction throughout the country. The Gambia Red Cross sits on United Nations level platforms to provide solutions to the needy on solutions like the coronavirus pandemic. Africa Live Team is at the GRCS headquarters in Canifin to extend chat with the Red Cross for this edition of the Good Morning Africa program. And joining us live as always is correspondent Ibrahima well, thank you, Ibrahima, for joining us again this morning. Well, what is the role of the Red Cross in this situation of the COVID-19?
The Gambia Red Cross Society has a very key role in this situation of coronavirus in the Gambia, knowing that this is a society that is well recognized with that reputation and credibility in terms of disaster risk reduction and then assessment procedures. The Red Cross is one of the institutions that every country can count on for, such a situation. So, meaning that, Gambia Red Cross, should be very busy. And I just want to recall for our viewers to know that Red Cross was responsible for the burial ceremony of the case that passed on, sometimes in March. That was the second case of the Gambia, the Bangladeshi national who happened to die of coronavirus in the Gambia. The entire, burial ceremony was handled by the Red Cross. That was the most visible aspect of the role of the Red Cross as far as the COVID-19 is concerned in the Gambia. But when you ask about the role, the Red Cross is an established institution working across corners in all areas within the country. So their assessment and understanding of the situation is very necessary to be shared, and for government to also, count on them for such a, corona time.
Very well. Now, how would the work of the Red Cross benefit the people, the hungry and all vulnerable groups?
The Red Cross has the potential and the capacity to do independent assessment of the dangers, the risk, and everything associated with the coronavirus, the good and the bad side. The Red Cross can always do that. As you know, this is an institution that has sitting or has access to UN bodies. It sits on national technical committee meetings. It is asked for, or its opinion is sorted for the decision or how to mitigate the risk and then how to suppress coronavirus is also not an exception for the work of the Red Cross. So the facilities at the Red Cross Center here, the mobility, they have the human resource, and anything that the Red Cross has in its headquarters here is very much useful for the Gambia, from the UN level, from the government level, and the civil society, even at the local level. The Red Cross can always, share experience, can always be as a source of advice. It can always, advise as to what is the way forward in such a difficult situation. The coronavirus having, killed a lot of people globally. In the Gambia, we're struggling with 6 active cases for now. Who knows how many more cases will become in the coming days. So this is why the Red Cross, we will discover tonight whether it is still sitting or how far has it gone in the management of cases or in planning for the country to build up its resilience on this situation of coronavirus.
All right. Now, talking about the experience and, of course, also advices like you have just said. Now, at national level, would the Red Cross have influence over decision-making on technical platforms?
Indeed, Red Cross is an influential body in this country and globally, I can say, because they have experience in the during the Ebola in the past few years, 2013, 14, yeah, the Red Cross was heavily involved in the situation of Ebola across the continent. They were in the sub-region. So some of the stories that they, earn from those engagement will be very useful. Away from that, even recently, this locust infestation, infestation in the Horn of Africa, when reports are always showing Red Cross being in the forefront. So this is an institution that definitely the government will listen to. Not only government, even ordinary people expect that the Red Cross is always counted upon for such a emergency situation. But what we will do tonight is to speak with the officials on the ground, and I'm lucky to have Buba Dabo, who is the head of the Disaster and Food Security Department at the Gambia Red Cross Society. I just pass the mic to him to extend greetings to Good Morning Africa. Buba.
Thank you so much. First and foremost, I want to thank the viewers and greet them. Good morning, and welcome to the Gambia Red Cross Society for this important interview that you want to conduct with us regarding coronavirus, as well as the role of Red Cross in general in the humanitarian community.
Following the outbreak of coronavirus in the Gambia, where did Red Cross pick it up in the service?
We started the very moment that the first declaration was made in China, in Hong Kong. And the Global Red Cross movement activated their response mechanism. And at that time, what we were looking at was the sensitization, awareness raising, information management for people to know how coronavirus transmits from one person to the other, and how can we prevent coronavirus. And in the Gambia, Gambia Red Cross was the first institution that came up with information materials. We printed out, we sent them to the Ministry of Health Communication Unit to ascertain and confirm before we started distributing. Because we are not alone in this, we always make sure that whatever we do is sanctioned by the Ministry of Health, because they are the health experts in terms of health-related emergencies. So we started since then, and then we roll out to all the communities, to the border points, to the public places, and that's what we have been doing. And now the crucial activity that we are doing in terms of sensitization is sensitizing the border communities, because we realize that official borders are closed, but the Gambia, we have a lot of porous borders, and people come in and out in the Gambia very frequent and very often. And therefore, to improve the knowledge and understanding of those communities residing along the borders is crucial and important. So we were doing this with IOM and the Ministry of Health.
Knowing that even after the borders were locked, the Gambia continued to receive cases, confirmed number of cases, and now the total is 6 active cases. In your assessment, what is the effectiveness of the lockdown?
Okay, it's not a total lockdown. It is emergency declaration which has some restrictions, and this restriction would surely, and they even have an impact on the ordinary population. When you say, okay, non-essential businesses should not be open to the general public. Okay, to the government, yes, they are non-essential businesses, but to the business person, it's an essential business. So there is no non-essential businesses in the world. Okay, for example, if I'm selling a second-hand clothes, that's my livelihood. So to me, it's an essential business. It cannot be quantified or identified as a non-essential business for me, because that's where my livelihood is. That's where I generate resources to put the food on the table of my family. So if that is closed, obviously the impact would be huge on me. And therefore, as I said, the restrictions comes with some ramifications. And this is where the government and partners should come with a strategy, a policy to make sure that all these individuals that have been affected by the statement due to restriction factor are supported.
The emergency has gone for about 20 days now, and the damage is being done or the good is being earned already. So what mechanism could be in place now to pick up the situation, to mitigate more risk?
In the global humanitarian community, what we call a twin track approach is what is needed now. When I say twin track approach, meaning as we are developing our preparedness mechanism, we should also automatically move into the response mode. Response mode in a sense that we should start providing the humanitarian services to this population that have been affected. We should also know that thousands of Gambian families are affected by food insecurity based on the harmonized framework results, which is published just the beginning of March. And those communities are already in the stress level. That means before the coronavirus, these people are already in a food crisis. And coupled with coronavirus, coupled with the government restrictions, that means the situation of these families is already complex. And therefore, what the humanitarian community should do is to look at the twin track approach. As we are dealing with the coronavirus, we should also try to support and respond to the related ramifications that comes with the coronavirus intervention. And this is where the Red Cross and other humanitarian partners are looking at. And by Friday, the Gambia Red Cross would launch its response supports to the vulnerable population.
What sort of response support? Since you've mentioned it, we just break it down a bit.
We are looking at providing humanitarian services like putting food on the table of this vulnerable population. And how we are going to do it, because there is a standard already. And we hail the efforts of individuals in this country that are doing this humanitarian gesture, but the challenge still remains on coordination. A lot of individuals are doing a lot of initiatives. It's good. It's good because we are all Gambians. We need to support our brothers and sisters that are in dire need of these services. But what is the strategy? What are the standards? Are we following the humanitarian? Providing humanitarian relief goes with dignity and it goes with standard. Are these institutions or individuals following those standards? Is a question mark. Are we coordinating them? Is a question mark. And this is where we need to put all our efforts together under one umbrella, and then we provide this holistic coordination architecture to make sure that each individual service provider is coordinated and standards are given. So for Red Cross, we received some funding from Ajira and also the Gambian Association in Norway, and some couple of individual Gambians that gave us some money. So yesterday we already dusted our response plan. It's already ready. Waiting for the approval from the Secretary General. And by Friday, for sure, we will start providing these humanitarian supports to this individual. And it is going to be a standard one, not what we have to send it to the community. No, it has to be a standard one.
Yeah, Mr. Buba, experts are now suggesting that Gambia is likely to witness thousands of cases of coronavirus. So is the country prepared for that?
The Gambia might not be prepared fully for this kind of disasters or emergencies because we've never experienced it before. So the process is a learning process for the Gambia. It is going to take some time before we said we are fully ready to address COVID-19. In fact, we will not be fully ready.
What is the requirement? What is needed to be done for Gambia to be at least that prepared country?
For the preparedness has to take some different phases. For now, what is more crucial for the Gambia is to make sure that all the health infrastructure, the health system, the supplies, the consumables are available, not only for COVID-19, but we should make sure that our systems are robust enough so in case we have another outbreak to deal with. So COVID-19 should be a reference for the Gambia and its partners to make sure that systems are robustly built to prepare ourselves for the subsequent outbreak, because COVID may even re-emerge.
You talk about hunger. This is interesting because you also work in a food security department. So you mentioned about 1,000 of people who are likely in hunger right now. So, but where should be the source of food that will ensure their food security in this country now?
Yeah, that's what I was saying, because when government declared a state of emergency, as I said, it would go with some ramification because there are restrictions. And this is what the government is trying to work with partners now to make sure that these people that are affected by the restrictions are provided with these humanitarian services. And last week, the humanitarian strategy committee was launched by the NDMA, and we are looking at how do we put up the strategies together to make sure that these restrictions for those that it affects are provided with these needed services. So that's what is going on. But also individuals are already doing it. So we will not wait for the strategy to come up. But as we are in the response mode already, so as I said, it should be a twin track system. When we are working on the robust strategy, a blueprint for the government to consider in the short term, medium, and the long term, we still need to continue with providing these services until when we have the blueprint and we consolidate all efforts into that blueprint as a master document that would guide our response.
We know you sit on technical committees at international level, so institutions like the UN. What is being decided at that level? Are you privy to some of the decisions that are cooking up?
Okay, at global level, I will not be able to talk about that for now. But on the country front, yes, I sit in the technical level. I sit in the PHEOC, that's the Public Health Emergency Coordination Center, under the logistics and safety pillar of that response structure. My Secretary General also sits at the strategic level. Now, the thinking now is how do we link the technical component to the strategic level? And this is where the discussion is going on. What is being generated from the technical level for approval at the strategic level is crucially important. But now, my suggestion would be, as somebody that has been in the disaster field for almost 15 years, coupled with some international experience, when the state of emergency was declared, our borders were closed, seaports closed, and then even the ground borders are also closed. Automatically, the coordination should have been shifted from the Public Health Emergency Coordination Center to the National Disaster Management Agency to coordinate, because the state of emergency has touched different components of life, economy, human rights issues, because restriction of people movement is a human right. So now the coordination should have been shifted. And now what is more urgent and important, because humanitarian issues are also been coming up in terms of COVID-19 response, the Gambia government should appoint what we call the operations manager. That operations manager would now look at the humanitarian component and the health component and brings everything under one coordination structure. So that particular person must be somebody knowledgeable, had international experience, and can also work with the government in terms of diplomacy areas. So this the government needs to appoint as quickly as possible to help in the coordination.
We know it is a very important recommendation by the WHO to emphasize or to implement social distancing. People should definitely social distance. But looking at the situation on the ground, in the country, you go into the market, you go on the traffic, do you think that people are listening?
People are listening, but people are not applying. And in the humanitarian community, what we call early warning, early action. Early warning can only be early warning when the actions follows. But we have been sending information. Ministry of Health is sending information. WHO is sending information. All other partners are sending information. But if these information are not acted upon, we are not sending any early warning. And then the complacency started when the 2 cases were treated and discharged to their community. The following day, the following 2 days, you can realize there is a huge complacency among the population. People just went back into their normal life. As I was coming today, in fact, in Brikama Market, I was talking to a few colleagues that it is very unfortunate. If Gambia, we started experiencing local transmission, it is going to be very devastating in this country because people are not observing social distancing anywhere. And this is something that we need to work on very well. People need to understand that the coronavirus exists. And then another information that we are receiving from the population is they have not seen any dead person killed by coronavirus. If we want to wait to see a dead person, it could be our own relative. May God forbid. So let us not pray to see a dead person because there is a dignity that we always worked with to make sure that these people, they are human beings, even when they die, they have a dignity that we need to protect. So we are not going to display the bodies of individuals that have been killed by COVID-19. No. People will see maybe coffins as they are seen in other countries, but they are not going to see the body themselves. That's
right now in the situation of Gambia, what template do you think Gambia can copy looking at international experience of the Red Cross in disaster situation? Is there any country you think Gambia can easily pick up as a example?
Cultures norms are completely different. You cannot copy a country directly to suit your own situation. Sometimes it's difficult. You can borrow elements here and there, and then you adopt them, you refine them to suit your own conditions. That means, as I said at the beginning, Gambia is in a learning process because this is the first of its kind that the Gambia is experiencing. A disaster at this magnitude or emergency at this magnitude, this is the first of its kind. So we will learn. We can learn even from Senegal, we can learn from Ghana, we can learn from a couple of countries. But we cannot just pick and adopt it that way. Our norms, our values, our cultures, our religious practices are different. So
thank you, Ben. We have to leave it there, sir.
Thank you so much. And what I want to give as my last advice is COVID-19 is here, and people need to respect the information that is being sent out by health experts, and we should observe the social distancing. And then anything that you are not comfortable with, please call 1025. Don't rush yourself to the health clinic, health facility. Call the 1025. Relevant services will come to your doorstep to provide these services. Thank you so much.
So, Amadou, that was Buba Dabo, head of disaster and food security at the Gambia Red Cross Society, and the message is clear. It is the same message from the Ministry of Health, the same message from the WHO, that social distancing need to be enforced. And the experience from the Red Cross is becoming eminent that, Gambia has a lot to do now at this stage in this coronavirus.
Very well, so thank you very much, and we will look forward to the response from the Gambia Red Cross Society. But for now, we've got to leave it at that. Thank you very much for your time again.
You're welcome.
Thank you. Ibrahim Presba talking to us live from the Gambia Red Cross Society's head office at Kanifing. Yes. wax nañ lu bari Ibrahima ak ki nga xamante ne mooy ki mu doon waxal noonu jàppuma sa tur bi waaye ñu ngi doon wax ci taxawaay li nga xamante ne mooy Gambia Red Cross Society mu nekk ni nga xamante ne mooy mbootaay bu am solo ñoom dañ day def ay voluntary services yàgg taxaw li nga xamante ne mooy ñuy liggéeyal li nga xamante ne mooy nit ñi jàppale ñi nga xamante ne mooy seen dañ xala néew doole wala seen loxo jotul seen gannaaw ak yooyu te fu mu nekk nii nag réew mi def leen gën a soxla te ñoom fu mu nekk nii comme ni nga ko waxee am nañ ndimbal ñu ngi def nañ li ñu war a def yëpp léegi xam naa ne fii ba ëllëg ak yooyu dañoo commencé ñoom tamit génne seen ndimbal yeggee ko askan ki te foog naa loolu dafa am solo.
trop am na solo lool te am na liñ si fekke woon sax parce que comme noo ko waxee rek dafa nekk ñoo xam ne ni dañ yàgg taxaw askan bi si lu nekk moo tax ñoom seen bunt bi ndimbal demee fa man loolu dafa dal suma xel bu baax a baax. because comme Ajira bu mu la wax noonu ñu ngi fa woon bi mu doon present almost 200 bag of rice 25 kilos bii nii jox leen ko ak ñeneen ak yeneen yu ñu am but according to seen secretary general Mr Senghor lu mu ko waxee woon mooy ne Mr Faye yow sax dañ la fi soxla ak képp koo xam ne indi nga fi donation pour ngeen xool naka la ñoo nekk di joxee li ngeen ñu jox delloo ko si askan bi xam nga loolu transparence ba dafa am solo trop pour li ñu la jox ku la ko jox tamit da nga bëgg mu ñëw nekk witness comme ni ko saa waaye doon waxee léegi xam naa loolu dina ko ne pour gis ne ñoom jaarale nañ ko si yoon parce que nekku ne Red Cross ñu waaye askan bi te ñoom xam nañ buntu yi ñoo dimbale askan bi parce que yàgg nañ si loolu mooy taxawaay seen taxawaay si réew mi kon bu seen secrétaire général bi ñëwee mention loolu ba pare ne ñoom ñëpp dina leen welcome pour ñëw ñi fekkee naka leen nekkee di joxee lii si réew fii waaye not comba rek de because si biti réew bi tam génn dëkk bi tuuti comme si région sa yooyu noonu mën a yooyu yëpp incha allah lépp lu ñu amee buñ ko séddale dina àgg si ñu war a àgg ba fu mu yem kon ñoom tam benn la si ñoo xam ne ni ku leen jox luy dem si askan bi dina fa àgga ak nu mu war a àggee foofu soo loolu nekk na lu am solo.
waaw lu am solo la wax nga ko sax ne ñu ngi xalaat yóbbu ko ba ci up country bi ci dex bi ma nga am na ki ma doon waxal sax mu ma wax ne dafa mel ni nag ndimbal bi ci comme bi lañ ko gën a centralise fii lañ gën a concentré sax ñu ngi xala fàtte ci op bi te loolu tamit war nañ ko mun a bàyyi xel bu baax ba waaye c'est good one buñ déggee Gambia Red Cross sax di wax ne ñoom dañ koo yaatal ba fépp ci réew mi foog naa ne loolu dafa am solo Julde ku xam Red Cross xam seen taxawaay ci voluntary service dimbale nit maa ngi doon xalaat sax ma ne ndax COVID-19 bi du dem ba xëy na ñu concentré sax ba fàtte leen li nga xamante ne xëy na ñu ngi ko doon def donte ne sax ndimbal la waaye foog naa ne loolu yëpp ñu ngi koo soorale seen taxawaay moom xëy na COVID-19 bi moom mooy nekk jubluwaay ñëpp waaye tamit ñu ngi bàyyi xel bu baax a baax ci ni ñoo dimbalee nit ñi surtout si jamono bi nga xamante ne jamono bu doy waar la ci niñ ko mën a waxee.
waaw dafa am solo Amadou Gambia Red Cross Society or the Red Cross Society around the world ñoom they are known for voluntary services and humanitarian aid and they provide loan to countries around the world gaa ñu ngi def lu am solo especially the Gambia Red Cross Society gaa ñu ngi foo leen gis programme bu munti am fii si dëkk bi dañ dee gis gaa they are present there to make sure ne ñu ngi jox aids to these people and also other services so I think ne lii is very important comme Modou lu mu ko waxee rek I think sometimes tamit dono si dañ war a consider gaa in terms of funding because they also need it in order to help people because it's easier to them because already they have that connection with the people so it will be easier for them to do certain things that the central government will not be able to do so I think ne loolu noonu dafa am solo torop pour government bi tamit seetaat gaay ñoom tamit si wàllum ndimbal bi and donations si gaay give them a part of the donations boo xam ne they can also plow back to the society I think that is very very important and another point boo xam ne woon maa ngi ko bëggoon na wax nga ko ma ne ok read na suma mind bi moo nekk di rural areas oftentimes things will happen all these donations and all then they gis ne all the rural the urban area councils ñu ngi doon of course with the exception of Brikama area council ñu ngi jóg di defee but that's the truth ñu ngi joxe ndimbal si their various councils but the rural area tamit they need help they need support whatever it's coming in the urban areas should also go down to the rural area because they are part of the country they are Gambians they are citizens but at certain point most people are saying that they are marginalized which I think that it's very very true because most of the time danga dega combo donate nañ lii def nañ lii Kanifing def nañ lii Banjul City Council def nañ lii Brikama area council even though they don't have an impact
but they will perhaps they are also ñu ngi waaj gis nga nguur gi nu nga waajee mun naa Brikama tamit
well ñu waaj foofu noonu but what is on the right
man Brikama nag xam naa Brikama tam leen mun na am parce que Sonko tam temps yi mu ngi si presso yaa ngi gis ay fan si gannaaw rek am na ay mbokkam yi jóg pour nar ko lifi mais bi tam loolu bokk na si
that's not an excuse mu ne mu ngi liggéey ba pare moo ña loolu
that is politics okay this is
parce que dafa mel tam mu ngi si waajaa yooyu noonu seet naka laay defaree toogu bi parce que ñu ngi bëgg a foqar ni toogu bi wala
léegi nag
bëgg koo jël daal mun naa am si yooyu itam pression yi waaye xam na comme noo ko waxee rek mais bi ñoom tam ñu ngi si waajaay waaye mu ngee bëgg a yéex de
definitely
te wax naa leen olof nañu ne mbottu daal balaa mooy taanu nga koy wàllu parce que bu taanoo rek jeexal na